So I lost my mom in 2011, and about 2 months prior to my final exam is when I had my first child. So I gave birth to my son in January. What would you say is your life's best work? When you see certain people's life transforming, or when you probably prevent somebody from suicide, that's what keeps me going. For young clinicians or budding psychiatrists, what would your advice be? Um,
Some spaces are built to heal, quietly, consistently, every day. This is Aasare Neuropsychiatric Centre, a place shaped by listening, trust, and thoughtful care. At the heart of Aasare is Dr. Lakshmi, founder of Aasare Neuropsychiatric Centre. She has trained at NIMHANS, where she earned her DPM and MD in Psychiatry as a gold medalist. Her work bridges clinical rigor with deep empathy across psychiatry, women's mental health, and talk therapy. This is her practice, and this is her story.
some people find their calling early and never look back. Dr. Lakshmi is one of them, a psychiatrist who's shaped by curiosity and compassion. She has spent her career studying not just the mind, but the human experience itself. She earned both her DPM and MD in psychiatry from NIMHANS as a gold medalist, followed by a postdoctoral fellowship in women's health, mental health. Her work bridges clinical precision with genuine empathy, from founding Aasare Neuropsychiatric Centre in Bangalore to contributing to national journals. She was also one of the few psychiatrists to pursue a PG diploma in medical law and ethics from NLS, reflecting her belief that good medicine must also be with good ethics. Today, she joins us to talk about her journey, what it really means to heal, to listen, and to stay human while working with the mind. This is Dr. Lakshmi, and it's good to have you here, Doctor. Thank you. Um, I'd like to start off by asking you a question. Given your more than decade-long journey from education to founding Aasare, could you shed some light on how your journey has been in your own lens? Sure. So I think my thought of wanting to do something in mental health has been there right from the time I was doing my first or second year MBBS. Right, so I was sort of passionate about mental health from a very long time. So after I finished my MBBS, this dream of wanting to be in NIMHANS also is always there. Whenever I would go past in NIMHANS, I would think that one day I'm going to be here, not as a patient, but I wanted to study there and work there. So I studied for entrance exams, and I got diploma seat in NIMHANS. At the same time, I got MD psychiatry elsewhere in one of the private colleges. But then, because this thing about NIMHANS is always there, I chose to do diploma in NIMHANS, which is for a period of 2 years. And then I again wrote the entrance and did my MD there for 2 years, post which I was working as a senior resident. And then I did my postdoctoral fellowship in women's mental health. So finally, after that, I decided to start my own clinic, and that's how Aasare came up in 2020. So I think from 2011 to 2020 is my journey of learning in psychiatry has been going on. Yeah, I mean, NIMHANS is it's one of the top tier, prestigious universities in terms of mental health, and you've not just done maybe one thing, you've done actually two, which is DPM and MD, and you're also a senior resident there. So
We definitely had a lot of experience, studying from NIMHANS, working over there as well. And yeah, so basically, it's you always wanted to go there. It was what you were manifesting, and you actually achieved that as well. It's a really wonderful and fulfilling journey, is what I can say. In this journey, would you mind sharing any struggles that you have faced so far?
Of course, there are struggles in any journey, right? It's when you have deep passion and interest and hard work, I think you will be able to reach your goal, but not without struggles. Um, in fact, throughout there were several struggles, both in my personal life as well as professional life. But the passion of working in mental health is what kept me going. So I lost my mom in 2011, just after 2 months of entering into the DPM. So I think I would say that it began with that struggle. And I finished DPM, and about 2 months prior to my final exam is when I had my first child. So I gave birth to my son in January, and I had my final exams in April. So I would say that that was again one of the toughest periods, because everybody would, advise me. I mean, they're coming from a good point, but they would say that take a break and write your exams 6 months later. But somehow I was not okay with that. So I went back to work after 45 days of my maternity leave, and I wrote exams in April, and I actually got the gold medal. So it was very fulfilling that way. And I mean, again, writing entrance after 2-3 years is a struggle, right? Because it's not only psychiatry that we have to read. If it's entrance exam, you have to read all subjects of MBBS. So for MD, I had to rewrite all the entrance exams. I in fact got MD seat in CMC Vellore.
Okay.
And I went there, stayed there for about 2-3 months. By then, I got MD in NIMHANS, so I quit and came back. So I think even then, my son was just like 2-year-old, so I had to leave him and go to Vellore. For those 2-3 months, that was also hard, I feel, but wanted to pursue, and it just happened. So yeah, throughout there have been various kinds of struggles, but yes, it happened.
But what really stands out to me is that you were very persistent
Yeah.
throughout. Like, yes, a death of a loved one, and then you had your child. And I would say again, it's been part of your journey, right? Like no journey is like a straight line. So yeah, what I can see is that you've always had ups and downs, but you've been persistent with your goals, with your missions. So that's really I would say really commendable of you, lot. In terms of talking about life, as it's not a straight line, as I mentioned. What would you say is your life's best work?
Mhm. I don't think there's any one single thing that I can talk about. I'm blessed to have the support of a lot of people in this journey. I wouldn't call, all that I've done is, credit. I won't take credit to myself. I think that way I've been really fortunate to get support from my parents before, and later on, my husband, my in-laws, everybody who have really stood before me when I wanted to persist. But if you want me to say what is something that I'm really, proud of, or at least feel satisfied about my journey, is somehow I maintained my professional and personal life going together. Like, I got married, then I did one degree, then I had my first child, then I did another degree, then I had my second child, after which I did my postdoctoral fellowship. So I've sort of kept my family, personal life going along with my professional life. So probably I would say that is something that I would.
Okay. So I would say that is also your best work, which is handling everything at once, doing what you really like at the end of the day. Okay. For young clinicians or budding psychiatrists, what would your advice be?
I think it's very important to be grounded to our roots of what we intended to do when we came into this field, right? So, I mean, a lot of times I'm feeling that young people miss out on the core aspect of just listen to your patient, right? A lot of people who come, when they talk about some experiences which they are not satisfied about earlier, etc. The primary complaint is that, ma'am, doctor didn't listen to us. We might figure out that it is anxiety or panic attack in the first 2 minutes of our conversation, right? But the patient has his own experience, has his own story to say. And if you're not giving enough time and not giving a listening ear, they feel very, uncomfortable. So I would say that before you start thinking of diagnosis and what medicine should I give and this and that, I think it's very important to pay full attention and listen to your patients, their story. The diagnosis may be the same. Like, 5 people come, 5 people have depression. But not their stories are not the same. They go through various things in life, and they're coming here because somebody's listening to them. And I feel that's very important for us to, have that ground, irrespective of how many years we are in this profession.
Right. So basically, it's better to stay human and grounded and
Yes.
listen to your patients.
Whatever advances are happening, I mean, I know that advances are happening in terms of whether it is medications, newer ones, or in terms of different other treatments that we have now, like brain stimulation techniques, ketamine, etc. So a lot of advances are happening, right? But whatever it is, I think the basic things should still be to have that empathy, have compassion, and be there for your patient.
Yeah, definitely makes sense. I wish, every psychiatrist or, therapist actually has, the same ethos that you follow as well. In your day-to-day practice, how do you manage to balance, clinical work, documentation, managing your clients' progress, given the volume of cases that you already have? So how do you handle all of these, operations on a day-to-day basis?
It is difficult, especially when some days when we have back-to-back people, already the client is waiting outside, and I can't sit and make notes for 15 minutes, right? Because time is precious for everybody. So it becomes difficult to actually, see the clients through the day, and at the end of the day, sort of do documentation properly. If it is just the psychiatric follow-up, medication follow-up kind of thing doing, then we use softwares where we are documenting the short progress or what medicine the patient was on, etc. We would have that. Now that everything is digitalized, it's much easier. We don't have to keep files and records. So that is easier. But when there are longer sessions, when there are sensitive issues, when it's therapy sessions, etc., definitely documentation also takes time.
True. Definitely. So it's been difficult so far, whenever you have to keep notes or make notes. On an average, you mentioned 15 minutes. That's the time you spend for, taking notes for each of your patients.
No, I wouldn't say for each patient.
For
Like I
one
said,
talk therapy.
Yeah. I think if we had some intense therapy sessions and all, we also need time to process
True.
and write down. We can't sit and write down every sentence that you've spoken, right? You
Of
need time
course.
to process and put that session collectively. So at least 5-10 minutes is required to do that.
Right.
And
Makes sense.
finding that space of 10 minutes between clients is really difficult.
Of course.
Yeah.
True. If it's back to back, then you have to,
Right.
go.
And at the end of the day, when you're really tired, your brain is not working
Yeah.
that well to actually document all that you've done through the day.
Yeah, no, it's an hour-long session or maybe 30 to 45 minutes as well. So yeah, you have to keep remembering pointers while you're taking notes. Yeah, it gets disrupted in the middle. So yeah, totally makes sense. So you, as we already mentioned, we already talked about, you see clients, for talk therapy as well. How does that, as in talk therapy, shape your perspective on patient connection and listening?
Mm-hmm. I mean, all psychiatrists are not into therapy, right? There are a few who do therapy themselves out of interest and passion. I mean, we are trained, I'm not saying no, but some people pursue and some people don't. But like I said, I've always felt that having that connection, knowing the person in front of you in depth is very essential to know their story and what they're going through, etc. So I've always been very interested in therapy, and I've been doing it right from my residency days, and even after I've been a private practitioner. I feel it is very essential, for us to have therapy along with whatever other treatments we are doing, in the benefit of the patient. There are also a lot of people who do not like to take medications, or even if they take, after a while, they want to get off it. So you need to equip them with other tools to be resilient, to be able to fight their problems without the help of external sources. So I've always, believed in therapy.
Yeah, I've had a similar experience where I've spoken to many psychiatrists who mentioned that they want to know the person well before actually, prescribing them a medication. So I think that's the approach that you're taking as well, right? Where you're trying to understand the person in front of you, what he or she has been through, and basically understand if medications are a requirement or not, or basically just understand how your client or your patient is.
Yeah.
Yeah, a bit of a context for the viewers. Dr. Lakshmi is one of MyKaya's earliest adopters. And basically, for people who don't know, MyKaya is an intelligent tool that automates note taking for therapists, helping reduce roughly about 90% of manual documentation, which saves about 6 hours per week. To put that into consideration, that's half a workday. So essentially, it's the time that they can actually give back to themselves or to their clients. And you've been an avid user of MyKaya, as you already know, you've been using MyKaya for quite some time now. Could you tell us what actually made you try it out in the first place?
So like I said, I had difficulty in documentation and to find time and to do the manual documentation. And I was thinking that maybe I should look into some alternatives now that there is so much of AI everywhere and all that. Maybe I should think of something else. There are a lot of apps which do note taking, right? I mean, the session recording or note taking is done by a lot of apps, but then again, there is a fear of confidentiality. We don't know where that data is being stored or used, etc. So there's always an apprehension to use something before we know about it. So I think it was at that juncture that I somehow got to know you, and you spoke to me about the app, and I think there was a lot of reassurance given from your side related to how the data is stored or processed, etc. So with that confidence is when I started trying it first. And I also liked it that this is exclusive for mental health, not like a general app of note taking, right? It is made for mental health. So and that's how I started.
True, yeah. That is particularly our main aim, which was to actually create for mental health. There are thousands of note takers that are available, but sometimes they don't translate well, they don't transcribe well. And as you know, you can use my app for multilingual conversations. If someone's speaking Kannada or any other local language, you can actually mix match between languages. So yeah, that's definitely what we've been aiming so far. In terms of using MyKaya, you've already mentioned how it has been for you and how you actually started using it. But before that, so before MyKaya, how did you typically manage your session notes? Was it something where you would take notes during your sessions or after your sessions? Could you dive a bit deep into that?
It was all manual. I wouldn't use any app before this. While during the session, of course, I would make some pointers. and at the end of it, like concise version of what went through and what are my thoughts on what I should do ahead. Like what should I do in the next session, or if me and the client have come up with something as our goal to work in the next session, and sort of make some pointers and notes on that. But it was all like manual.
All like manual, like handwritten
Handwritten,
notes,
yes, yes,
no
handwritten.
Google Docs, nothing. No, not as such. Okay, makes sense. Since you mentioned how it was, how does a typical workflow with MyKaya looks like right now? So when you're having a patient, and you're speaking to them, how has it been for you that since you're using MyKaya, like what has changed specifically in your workflow?
Mhm. The good thing is it works both for online and offline sessions. And I mean, normally ask my client if it's okay to use this. Most of them say yes. I think there are very few who are not comfortable with their session being recorded or something. But most of them, I think more than 90%, I would say, usually say yes. And it's just there. I don't think it interferes in the process of the session or anything like that. It's just, my laptop is just lying there. Um, it does the work of recording, translation, transcribing, everything beautifully. Like you said, patients also switch languages in between, right? They're talking in Kannada, then they suddenly switch to English, Hindi, Tamil. So it is able to sort of understand all these things, and I've never found that something is transcribed uh, erroneously or something. It's really good. So it saves my time in terms of noting down what was happening in the session, and the summary given by MyKaya is almost like how I would do. That's why I feel that that app for mental health thing is really special as opposed to some other app you use, because the kind of summarization that happens in this app, I would say, clearly shows that there is material gone into it. There are technical words which are used, specific therapeutic techniques that are used, which the app is able to understand why we are talking with the client. So, yeah, I always found the summary to be as good as what I do. Sometimes I've even sent the summary back to a couple of clients and asked them what do they feel about it, and they say it's fine, and they say it's pretty good.
Okay.
Yeah.
Okay. Yeah, I remember you mentioned
Yeah.
this during our one of our Zoom calls, and to be really transparent here, I would say that Micah was riddled with a lot of problems in the start, and thankfully it was you who was probably the top 5%, just to report that hey, sure this is going wrong. And I used to spend maybe days or nights actually fixing those issues.
Yeah. I think the primary glitch that we have had was it was with longer sessions, like 60 minutes or more than that and all.
Yeah.
It wouldn't like upload. I think that was
Yeah.
something that primarily bothering at the beginning. But you managed to like really set it.
Which specific, as I remember you mentioned about summary and insight, but out of all of these, which specific part of MyKaya do you find most valuable? Like you would say it's like probably the top three or maybe top one is something which is really valuable to you in your use case.
I think it's the summarization and pointer to the next section, which we would ideally look at, right? I mean, though it records line by line, I don't think we ever go back and see line by line what we have spoken and all that. What we want is when we are starting the next session, before that, I want a minute or two to just like recap on what we had done before and how I should plan this session. And for that, the insights of the app, as well as summary of just not the last session, but it also give a summary of all the sessions that we have had.
Yeah, for a specific client.
Right. So, because the clients do talk about a lot of details, sometimes they may be unnecessary. What we need to know is the core problem. What we need to know is just the gist of the issue, right? To be able to carry through it. Like for example, if somebody is having say an interpersonal issue with a friend or mother-in-law or something like that, they would probably give a lot of details on every single, event or fight or crisis that they have had with the other person. Which in total we may not need. Like I don't have to make notes of everything that the client has told me related to the other person. But I need to know what are the areas in which they are having conflict, which are the areas in which they're finding it difficult to handle, etc. And that is what the app does beautifully, I feel.
Okay, that's fantastic to hear, doctor. Since you're using MyKaya for quite some time, how has it impacted your time? Your focus and even your connections with your clients.
It's definitely saved time because now that I'm relieved that it's already being done and I don't have to give extra time to documentation. I think even my focus is better because I'm not doing the simultaneous writing down. Sometimes clients may also feel, even though we are paying attention, if I'm simultaneously writing down, they might feel I'm not fully focused there, right? So this takes away that load.
Yeah, this actually acts like it's in the background.
Yeah, it's in the background.
Yeah, it's not
Not
someone
in
who's
between us.
yeah, it's not someone who's typing or maybe writing down, jotting down notes. So yeah, it's good to see that clients also feel at ease when this is the case. Not everyone, of course, but for few clients it would be for sure. Okay. After you've used MyKaya extensively, would you ever go back to your old ways? Like, let's assume MyKaya never existed, right? And you're back in time where you're doing all note taking. Manual note taking on a notebook or a scratch pad. So, would you ever go back to that time?
No.
No?
I don't think so.
Okay. As someone who's deeply trained in evidence-based and humanistic care, how do you see MyKaya fitting into the future of therapy?
It is very, very important, I feel. AI is there in our lives everywhere now. I don't think we can ever say we live without it. I think the way we use it is what is important. How we make the best use of it. Not totally depending on it, but then make it make the best use of it in our ways. So that way, MyKaya also. I'm not saying people should rely on apps completely. Though MyKaya gives insight as to what probably you could try or what form of therapy might help, etc. It does give insights like that. I'm not saying 100% you go towards it, but it's definitely very helpful in terms of documentation, saving time. Like you said, you can totally focus on the client without bothering about note taking, etc. That too, I'm a psychiatrist. Not all my sessions are therapies, but psychologists, of course, they are doing this job morning till night. So imagine the number of things that they have to write down, keep notes, and follow it up next session. So I would say it's very helpful and it is going to stay.
Yeah, I like the bit where you mentioned about not to completely rely on it because that's completely true. One thing that I would say human is really important or vital is human intuition, your gut instincts. AI can look at numbers or maybe summaries, but as a human or as a person, you would probably make the decisions. So basically, when MyKaya gives you insights and everything, it gives you a lot of insights, right? Out of which you can always filter out and apply to your patient because at times, even the AI might not know entirely about the person, but you would know, okay, maybe this specific angle works out, maybe a certain area that needs to be explored is given by AI. So it definitely allows you to helps you with or assists you with your sessions. But when it comes to decisions, it's definitely something which you would partake in. So yeah, we are almost near to the end of our little chat, and we'll now move on to our final question and even the closing remarks. Once again, thank you, Doctor, for sitting down with us here and actually sharing your journey and few things that you've experienced with MyKaya. And from our chat, I can definitely say that MyKaya has been vital in helping you out with your sessions. And yeah, so we have a final question that ties everything together. Uh, what keeps you inspired to continue working in mental health, especially in a space that's currently been evolving fast? So, what keeps you, I would say, motivated that, okay, I want to pursue or I want to keep doing what I already love? So, what's your main motivation for that?
I think for anybody to keep pursuing in their jobs, it is the job satisfaction, which is primarily important. Of course, monetary benefit is there in every job, but that passion which you have towards what you're working determines how much you can work, how long you can work, etc. See, the more and more we are in this field, we get to know that every age, every gender, I mean, everybody has stress and mental health problems, just like how we have with our physical health. So, be it children, be it geriatric population, be it women, I'm specialized in women's mental health. So, I do see a lot of women in postpartum, menopause, those kind of things. So, anyhow, anywhere you see there is stress, given that current fast-paced world where we are all the time trying to achieve more and more and more. Compared to our ancestors, I feel all of us have more money, all of us have a better standard of living. All that is there, but mentally we're not in a space like how probably my grandfather or great grandfather was there. So it is a very stressful life, and I'm glad that I can be of help to people who are struggling with so many issues in life and probably feel like they have no one to talk to. Yeah, and that way, this field is extremely satisfying. You may not be, it's not like an emergency medicine where you perform a life-saving surgery or something, right? But here also, when you see certain people's life transforming, or when you probably prevent somebody from suicide, etc., it's really gratifying, and I think that's what keeps me going. Just to add, of late, from the last 1 year or so, I've also been interested in promoting mental health rather than all the time treating it. So I'm working with children and adolescents to help them gain resilience before they even get into problems. So I'm involved with an NGO called Civic Life School, and we are working towards the holistic development of underprivileged kids. So, yeah, I see myself in this field
Okay.
quite some time more.
Makes sense. So you're actually like a superhero, like, but maybe without a cape, but you're actually there to, lift people from that, trough or like the really down part. But yeah, I think a lot of people don't maybe look at it. In a way, mental health has been a very crucial part and very important, as you mentioned, and it's really good to see, and it's actually an honor sitting with you here, just to listen from you that how it has been inspiring for you to actually help people understand themselves better, and even for yourself as well, as to to hold space. So that is really commendable of you, doctor, and we really appreciate the time that you've given us, and hope we can actually make a difference in the lives of people, or India, or broader community, mental health community, or the world as well. So thanks again, doctor. And
Just before we finish,
for sure, yeah.
Just not me. Everybody, all mental health professionals are trying to do their best in terms of helping people in their struggles. Even though the awareness is much better today as compared to a decade earlier or so, even now, the times when we ask people to get into therapy, etc., they feel like, why? Am I mentally sick? Am I psychotic? Or like, why should I go to a therapist? Why should I go to a psychiatrist? So everybody can go to therapy. I can go to therapy. You can go to therapy. Everybody can go to therapy.
Of course.
So I think people still need to get there
True.
to understand that therapy or any of the mental health supports that we take is not only for illnesses. And it doesn't mean that you need to be severely depressed to take help.
True.
I think all of us are struggling through various things in life, and having a therapist it should become as common as having a family doctor or a general practitioner, where you pick up your phone for everything and ask, right? Okay, doctor, can I have this? Can I do this? Etc. Same way, I think one day should come where mental health also, is seen like that.
Yeah, it seems
Yeah.
casual, and just that you can actually talk to someone.
The stigma related to taking treatment, going to a therapist. We need to see that it gradually comes down.
True.
Yeah.
Yeah, definitely. And yeah, that includes a lot of people who are not really, open to talk about their, trauma or whatever they face. But yeah, as you mentioned, hopefully that becomes more easier in the coming days, where people are opening up and at least releasing or when to whatever they want to. So yeah, we actually are also hopeful for that future to come. Thank you so much, doctor.
If you want to be part of such podcasts and spotlights, you can send us an email at team@mykaya.app. And if you want to see more such podcasts, feel free to drop a subscribe and follow us on our social media channels.